let us know when you want us.
Oh,
you're going to start?
Yeah.
Intro?
Hey, everybody. Welcome. This is Mike. I'm at DDI tonight, and we have a group with us here tonight. So before we get started, we're going to go ahead and have everybody in the room here introduce themselves. So you want to start, Sharon?
Hi,
I don't think they can see Sharon
Hi,
over here.
that's my hand, Sharon.
Go ahead.
Hi, I'm Carla Brewer. I'm the project officer for LEND at the Maternal and Child Health Bureau.
Go down one so he can see.
And hi everybody,
There.
I'm Ben Kaufman. I'm the Senior Manager for Maternal and Child Health Technical Assistance at AUCD, and I work with all 52 LEND programs.
All right.
Hi, everybody. I'm Abby Johnson. I'm an assistant professor in rehab psychology, neuropsychology, and PM&R at U of M, and I'm one of your presenters tonight.
And I'm Jenny Mendez, and I'm from Wayne State University School of Medicine, and I'm your co-presenter with Abby. We're going to walk through our objectives, and we'll go through some of the slides, and then we will allow our trainees to present to you what they have been doing for the last 10 days or so. So we'll pick the next slide, please.
Go ahead and show it for you.
So we will be defining interprofessional practice. We'll be introducing the case. We have a team presentations, discussions, and then a couple minutes towards the end as to why interprofessional practice matters. As you know, in our intro session, we did do a hands-on exercise to give you an idea of what it meant to be a member of a team where you were trying to build those little chains with the paper and cutting it and sticking it and whatever. Next slide, please. The team will be a virtual team. We will be discussing an initial treatment plan and goals for Jenny. There will be discussion where each team member will be moving around for the role that they are playing, not necessarily the role in their own professional practice, but the assumed role that they have given them. And one of you is also playing the role of a patient. The things that we asked you to focus on and present to us is the impact of conducting an assessment as a team. How does that make a difference to the patient as well as to team members, and to identify factors that determine successful functioning of a team.
And these are questions that we actually want you to be thinking about now as we are going through the exercise, because I think all of you know from your homework assignments, we actually gave you slightly different questions to get ready to present to us as a treatment team tonight. So I have a few rules just in the spirit of good multidisciplinary communication. We did ask everybody here to research a role that's not their profession and adopt that role tonight. So try your best to maintain your character, maintain your role instead of your real professional identity, and also be a little bit generous with your team members, because we're asking everybody to stretch tonight. No dentist is playing a dentist, and no psychologist is playing a psychologist. So use respectful communication as always. The other thing to keep in mind is that we do have a lot of groups, and we do want to leave some time for discussion. So I'm going to be giving everybody about 3 or 4 minutes, so your slide gets about 10 minutes or even a little less to talk. But if I'm bumping you along, I'm not trying to be rude. I just want to make sure everybody gets a chance.
I drop in too. So when your group comes up, please remember to unmute yourselves. Thank you.
So what's going to happen next is we have one of our guest stars who's going to read the case for us. Oh, I'm sorry, I skipped a slide. So when we start the case discussion, and we're creating kind of a virtual team meeting, each group is going to present the 3 main treatment goals of their group and sort of review for us who you are and what your main questions were. But then your goal as a large treatment team is going to be to, as a large group, once you've gathered all this information, summarize what your next 3 action steps are. So as you're listening to other groups present, I want you to be integrating that information, thinking about how this fits in the overall case presentation. And then I have a suggestion on this, but we need somebody who's going to speak as the team reporter or the team leader, what those next 3 steps are. And there are a couple family members in the group. So Janie's not here as part of our treatment team, but I think both of her parents are. So if you are one of the parents, I want you to be thinking about, what questions might you have as a family, and again, adopting that role. So after everybody presents, we're going to be asking you to have this team discussion as a larger group. And so now I think we are ready to introduce the case of Janie,
Okay.
and I'll let you read it.
Janie is a 10-year-old with a diagnosis of ASD and intellectual disability who goes to her doctor for concerns of stomach aches and vague complaints of illness. She has a history of seizures that have been difficult to control, but stable for the past 6 months using medication and a special diet. She goes to school with the assistance of an aide because of her risk for seizures and her difficulty with communication. Janie also attends an outpatient rehabilitation facility for therapies. She sees several medical specialists as well as standard medical appointments, including follow-ups with her dentist and primary care providers. Janie's family has been very active within the ASD community and is interested in helping for children across the state. They have begun talking with different organizations who can influence policy for children with disabilities at a broader level.
All right, so the first team that we want to have is Team A, and I will let you guys take it from here. We don't have to read this slide aloud, but John, Sandra, and Jay, oh good. I will let you guys present, and I apologize, I broke up your slide just a little bit so it'd be a little easier to read.
John, go ahead and start because I know you have to leave.
Okay, thank you. So the first question was, how can we best address the concerns regarding Janie's stomach? So, looking into some of the policy in Michigan, dietitian visits can be covered by Medicaid in Michigan. Making this information widely available to Janie and her family would be a great first step. I know that there's several dietitians who specifically have specialties in working with autistic clients who may be able to come up with a more palatable diet for Janie. So something like making a list of acceptable foods, but more so from a policy standpoint, we know that special diets can be very expensive and difficult to maintain. So if we could organize a fund that helps cover some of these costs, we may be able to allow the family to buy more healthy foods that fit her diet and that are more palatable for Janie.
And John, can you just remind us what the question was that you were going to address?
Sorry, I forgot. We don't have the same questions. The first question was, how can we best address the concerns regarding her stomach? And do you have any information on what some of those might have been? Her stomach? The concerns?
Yeah, what was the complaint?
1 second, I have that right here.
Here, I can actually, sorry.
So Janie has stomach aches and vague complaints of illness. She often sneaks down into the pantry and grabs whatever food she can in the middle of the night. And we're assuming that a lot of these foods that she's able to grab are not on her special diet. And this may be causing some of her stomach illness that she's reporting to her family and doctors.
Thanks for that.
Mm-hmm.
Sense.
Do you want the rest of the group to go over their concerns?
Yes, so Sandy can be next. So Sandy was a PCP. Sandy, can you unmute, please?
I'm on unmute. I'm just trying to look my slide over because it doesn't, I'm looking like it's different. One was, is that what I'm looking at, John? I don't have my slides. All I have in front of me is this one right that we're all looking at.
Okay,
You
that's okay.
want to go to Jay and come back to Sandy? You can get your slide up.
That sounds good.
Okay, Jay.
Okay, so as Janie's brother, I'm just really concerned about the fact that she just keeps going down to the pantry and sneaking food late at night when parents aren't watching or I'm not watching. And so, I think that's the reason she's been waking up with the stomach aches in the morning, especially in the morning, and the pain usually subsides for her when she takes a nap during the day. And really the morning time is really the only time when she complains about stomach ache. And so I think that's just a result of her just snacking on junk food late at night, especially the kinds of food that she isn't supposed to eat. And so I'm worried that her inability to digest those junk food, is constantly building up toxins and worsen her seizures, and the possibility that a seizure would just come on unexpectedly, just without any foreshadowing for us is really daunting for not just me, but for the parents also. And so I would like to, I think John's suggestion on coming up with a list of foods that would be better suited for her, not just for her special diet, but for the rest of the family members too, so that we can all try to get used to her diet as a family, as opposed to just keeping a separate diet for Janie. And so I think those special measures are going to be really helpful for us. My general concern is that, Janie will continue to do this out of habit, and her health will just worsen over time.
Mhm.
What role do you see the local health department playing here?
I'm sorry, what was that?
The local health department, what do you guys see the role for the health department?
I see the role.
Go ahead, Sandy.
I see the role from the health
Can you
department.
increase your volume, please? Okay, go ahead.
Go ahead, Sandy, we can hear you.
I see the role from the health department with children's special health care. They can provide some supports for the family. They can work with the family on what might be available in the local arena. Children's special health care, get them onto that. Those are the types of things. So, if anybody has anything else to add to that.
What about transportation, Sandy?
Transportation would be left up to, if they have Medicaid, chances are they have a Medicaid health plan. So the Medicaid health plan would be the one to link them up with available transportation. They could provide a driver if the family doesn't have a car, or they can help you.
Thank you.
All right.
John, your excuse, and if you get back, great. If you don't, have a good one.
Okay, I thought we were going to go question by question, because I can.
If you want to add anything, Team A, please do so at this time. Others are moving to Team B.
Okay. Well, yeah, that was one of the things we're saying in general. It's not that she might not, have access to all of these, services, but getting there. Both of her parents work full time. She's younger, or older brother who might not be able to transport her. So setting up a fund or finding, community transportation to and from meetings might really help their predicament.
All right, good. Thank you.
Thank you guys so much. I'm sorry I have to leave.
That's okay.
That's all right.
All right, Team B.
All right, so Team B, we've got a social worker, a speech pathologist, and an occupational therapist who are working as part of Jane's neurodevelopmental team. So you guys let us know.
And team members also tell us what your original background is when you introduce yourself. Thank you.
Okay, so I am Kate Russell. My real background is I'm an audiology student, so my background is in hearing and hearing loss care. And I was assigned to be the social worker for Team B's treatment plan. And so I think that from the social work perspective, to address the eating concerns, I would first want to ensure that Janie's family has proper access to a variety of healthy foods. Make sure that that's not a barrier into her restrict what all the concerns are. And then also evaluate and see if there are any aspects of Janie's home life or her family relationships that may be causing an aversion to eating and causing any kind of additional stress to the situation. So that's what I would expect the focus of social work to take during this.
Good, Ishmael. Ismail, can you turn yourself back on? Keep talking.
Okay. So my background is school psychology, and I was assigned to be the speech pathologist. So I guess the first thing that I will be looking at is if there's any pain with swallowing. So looking at things like desensitization for the child, and simply looking at the swallowing, seeing if the child knows how to swallow properly, if the child is chewing. Sometimes the child hasn't developed the chewing well, like they could be mashing the food on the side of their mouth and then just trying to take a gulp. And so when they do that, when they haven't learned how to chew properly, it causes pain. And then those more difficult textures they don't want to chew, they don't want to eat. So I would look at things like that while the child is chewing. Another thing I would look at is trying to puree the food or maybe wet ground the food, because if the child isn't eating that much, it means that they're not getting a lot of calories. So we want to increase the calorie intake, and a way to do that is if we can puree the food, then we can make it easy for the child to consume. And if the child can take liquids and things like that, then perhaps we can move to wet ground, which is a little more thicker of a texture, and then slowly progress to regular foods.
Thank you. Christine?
Okay, so I am a medical student, but I was assigned the occupational therapist role. So first I would want to know why she's not eating, but since I found out from the other group that her stomach's probably hurting because she's eating food she's not supposed to, my way of doing things is going to change a little bit. But if she wasn't eating because of texture or anything like that, we could implement sensory integration therapy. If I was personally qualified to do feeding therapy, which is a subspecialty of OT, I could implement those techniques. But since it seems like she's not eating because she wants to eat other foods, I would probably just work on different behavioral techniques, such as teaching her like what is allowed to eat and what's not, because through working with her, she seems to respond really well to positive reinforcement from me. We have a really good connection, and she really responds well to motivation from adults. So I think it's more of a behavioral issue than more of like an eating issue. So I would probably focus more on that.
Can you give us an example of a motivational question that you may have used with Janie?
Well, now that I know that she's sneaking food, I guess I would probably just start with trying to get to the root of why she's eating other foods. Like maybe she doesn't like the food that is provided to her. And I would just try to get to understand more like what kind of things she would like and work with her to find things that she would like that are allowed on her diet, and just kind of give her more information on why it's good to eat the, like in the long run, why it's important that she sticks to her diet.
Thank you.
Nice job. Any other comments from Team B? All right, thank you guys. So we did do a little bit of an out of order scramble for some folks who are arriving later. So Team D is up. And just because I know you guys don't necessarily all have this when you're answering the questions, this is her dietitian, her teacher, and her dentist. And they're working together to try and find some recommendations for her school nutritional plan. So you guys can update us on what you're working on here.
Madison? Madison, can you unmute?
Okay, there we go. So I'm actually the audiology student at Central, and I was assigned the dietitian role. So a few things I would want to check would be, I want to explain to the school the importance of why she needs the food she needs. I think there's a lack of understanding between them, since the parents have tried and they haven't been very successful according to our report. And then I would also want to know, again, I know Christine touched on this, but what food she likes versus doesn't like, to see if we can incorporate various snacks into her day that don't include those foods that have sugar and dairy, since she tends to get an upset stomach when she has dairy. And then I would want to work with the other professionals to create an eating schedule. Since she does have autism, I'd want to make sure that we could maybe create like a picture board as to her schedule, so she knows when she's eating lunch and having those snacks.
So I am Katie, and I am an OT student at Western, and I was assigned the role of the dentist. And so first and foremost, she has this token economy in class, which is positive reinforcement. She's given goldfish and sometimes candy. I think the first concern would be changing that token economy to not include those kinds of things, but rather healthy snacks to improve her oral hygiene. And candy is found on her desk, so maybe negative consequences such as losing time free time or recess time or whatever that may be, when she does have candy or is holding that. Also, the OT in the school may be able to work on oral hygiene techniques with her. Typically, this type of thing isn't really worked on in the school. It's more academic based, but it is a possibility, so that could be addressed as well.
So Katie, do you think that the school might be giving out snacks that the teacher could be helping with?
Yeah, definitely. I think, like I said, I think I read that she had this goldfish and candy as a reward. Or those were the snacks that were given. So changing those types of snacks to healthier snacks would improve that, and as well as her stomach aches.
So since we had a dentist in the previous group, in team A, I think, no, we didn't have a dentist.
We do have two dentists.
Yeah, we have two dentists later. We'll get back to the dental one, okay?
Jay went, he's a dentist.
Yeah. But the role.
The role, I'm sorry.
Yeah, we are reverse roles. We will
Not
come
a
to
real
the,
dentist.
we come to the real roles later.
So Katie, we might ask you as also a dentist to collaborate with your dentist colleague in a little bit when they report.
Okay. All right.
Any other comments from your team about how school's going and eating at school? All right. So then we're going to move on.
Going to team E.
Team E.
Yeah. Michelle.
And this is also part of her school team. So yeah, Michelle, I'll let you take it from here.
Can you hear me?
Yep.
Yep.
Okay, awesome. We have a little bit of a different role. We didn't get information about an eating issue.
Michelle?
So my background is in early childhood education. I taught kindergarten for many years. I'm here in this program as a family member with an awesome kiddo with a developmental disability. And today I am a social worker discussing Jeannie's role here. And the information that we were given is that Jeannie has an IEP in the ASD-based classroom, and we're focusing on an educational goal with increasing Jeannie's communication and accessing assistive technology in her classroom. And so as her social worker, getting to know her better, I've seen some skills that we're working on, such as self-calming and asking for breaks, and helping develop positive behavioral plans for her at school, so that that will help her communicate. So one of my recommendations, as you can see on the slide that I've provided, is that she could really benefit from a program that we use at our school called Co-Writer. And it works much like texting on your phone. It would give her words to choose from. So when she's working on writing things, it's like the first couple of letters that you type in would pop up some words, and then she could choose those words to communicate with. I feel that this would expand her vocabulary, but it would also reduce the frustrations that we're seeing at times with her expressive language deficits. And then I think it would also help her with the fixations that we've learned about now that we're getting to know her a little bit better at school. I also would highly recommend, as a social worker, the Social Express app, a text-to-speech, and using the Smarter Balance assessment while using picture cards and social stories to help increase that positive social reactions to her typical developing peers. So that's my recommendation.
Michelle?
Yeah.
In terms of the parents that are going to be working with these apps, what recommendations do you have for the parents?
I say, fully immerse them. There's no bad mistakes or anything. I think the more that you use it, the better you'll get at it. It comes with time to take a deep breath and just kind of keep rolling through it. And that honestly, if they can just model, the more modeling that they can do will increase that language, which I think in long term will help her behaviorally too, to be able to get those communication devices for her. maybe helping them get that eval. Because I was unsure if she actually has an assistive communication device yet, or if they're still going through the process of getting that evaluation so that she can receive that. But yeah, definitely just modeling it at home, working through it, and not getting frustrated, not giving up, just keep going.
Thank you.
Yeah.
All right. We'll go to Peggy.
Can you hear me?
Yeah, go ahead.
Okay, my real role is I am a nurse, and so in this case, I play speech pathologist, and so this is quite new and different for me. So in this role, the main thing is to work on expressive language for Janie, and since she's 10 years old, think about things that are appropriate for her developmental level, because she's sort of like at level or slightly below, but working on having her communicate, and using the assistive technology is the pathway that we had wanted to make recommendations and go towards, and that would be through the iPads, computers, and the different recommendations that Michelle had on the different programs would be what would be supported from the speech pathology perspective.
Are you going to engage more able-bodied kids to help out in the classroom? Sometimes you have students who want to be helpers. How do you see the role there?
So having like peer helpers would be one idea, where they would be able to, help be interactive and, just continue to talk and communicate and dialogue back and forth with Janie in a setting like that. I think that individual plus, like small group or integrating things into like larger classroom things, would be helpful.
Thank you. Claire, we'll move to you.
All right, so I'm Claire. I'm an audiology student at the University of Michigan. And so today I am a policymaker. So my main concern was looking at Janie's case and seeing how this case could be used to influence policy about education in general and specifically in special education. So what I mostly focused on was looking at the adaptive communication device specifically and how that could improve Janie's communication within the classroom, either with her aide or with the other students, with the teachers, and really focusing on how important this could be with communicating with your peers to try and improve the overall interaction. And so the improvements with this device could be represented and documented by the speech language pathologist and the other professionals, maybe social work, after they see Janie using this device and how it improves, maybe her experience in the classroom. But from a policymaker standpoint, I want to identify how this device would be used throughout the school day. So if it's disruptive or intrusive at all or distracting in the classroom, or if maybe it's something that's easy to use and approachable that maybe other students would be interested in looking at, and then that would also improve communication. And then if it is something that, for example, some of these apps that might be inexpensive, that would be something, a potential change in the policy, and it could become something that's more easily accessible and usable for other children in other classrooms. So kind of looking overall at really the device and the apps.
Claire, could you speak to the role of the legislators? How do you see yourself advocating as now your real role that you are versus the role that you're playing as a policymaker?
Wait, so you mean, well, can you,
okay.
I'm not sure I understand exactly.
From your background.
In audiology.
In audiology, speaking
yeah.
to a policymaker regarding this.
Regarding Janie in general?
Just what you want the assistive devices to be and things like that. How would you approach a policymaker?
Well, I don't exactly know Janie's audiologic history at all, but I know from a communication standpoint, based on Janie's case, I think from a legislation, like at least to bring a case to a legislator and to advocate for her case,
Correct.
would really focus on the importance of peer communication. I mean, many studies have shown, and many professionals have shown that that's really the best way for kids to learn language and to really pick up on some of those social cues and learn a lot of behavior. So I would really focus on her case specifically, and maybe just the changes it's made.
Thank you.
Great.
So go to Team F.
All right.
Kayla's not here yet, so.
Oh, okay.
Okay.
We are whizzing through, so we pushed one group. Well, we've got
We can go to Team F.
yeah. So we've got one more group. We'll see. If
Let's
she
go
can
to
make it.
Team F and then come back. Yeah.
So Team F is up. This one has an audiologist for the purpose of this conversation, a primary care physician, and a teaching assistant. So why don't you guys kick it off for us?
Richard, you're on, right?
Can you hear me?
Yes.
Yep.
Okay, cool. So our problem was that the mom came to us asking the audiologist and the primary care physician if we could come in to help with the school to see what interventions might be suggested to help her be a little bit more, to help with her learning. So how can we determine when Janie is having trouble with learning, and then what kinds of interventions do we propose to keep her working and compliant at school? So I'm, in my real life, I'm going to school for applied behavior analysis, but here I'm going to be playing the role of the audiologist. So I would like to suggest further testing to be conducted to rule out more hearing issues. And for this to be done, the inattentive and non-compliant behaviors that Janie exhibits need to be a little bit more managed. Based on previous information, previous audiological evaluations, it was reported unreliable due to her behaviors. So possibly desensitizing her in the classroom and at home to various audiological testing using headphones, showing her what a sound booth is like during testing, practicing these conditioned play scenarios prior to testing in the future will help to result in better compliance and more reliable evaluation. But based on the evaluation that was done and the diagnosis that she has of a mild high frequency hearing loss, it doesn't show great significance to jump to a hearing aid for her problems, but it's suggested for an intervention to use an FM system in the school to see if that would help solve the problem, and then with the desensitization and with more control over her behavior, maybe doing further testing in the future to rule out other issues.
All right. We'll go down to Emily. You're the primary care physician.
Hi, my name is Emily Milligan Thompson. My background is educational evaluations and research. And today I'm the primary care physician. So the first thing I'd recommend would be to start ABA therapy for 6 months. Also to add fish oil, which omega-3 and omega-6 supplement to her diet that has been shown to help with some inattentive symptoms. I wouldn't be opposed to prescribing stimulants for these behaviors. However, I think we should check and rule out other seizure disorders, particularly absent seizures, to see if that's the cause. So I ordered an EEG and an MRI so we could check those out. And that's it.
All right. I'll go to Sarah.
Okay.
You there?
Yep, I'm here. Can you hear me?
Yes.
Yep.
Okay. My background is in audiology, but today I am Janie's new teacher assistant. So we're going to recommend functional behavior assessment and implementing parent or teacher questionnaires regarding Janie's preferred learning style. We want to understand how Janie learns best, which is going to provide more access to her academic information in terms of what she's comfortable with, while trying to reduce the frustration and non-compliant behaviors. We also want to utilize or continue positive behavior supports and reinforcing behaviors, particularly when Janie is compliant, to promote those desired classroom behaviors. Then in regards to implementation and intervention, it's going to be best to first assess Janie's medical status. So obtaining more reliable audiologic evaluations and looking for further into Janie's seizures to help determine if her non-compliance and inattentiveness can be medically addressed, or if behavioral interventions are going to be the best course of action. But in the meantime, we do want to continue to provide a structured approach with positive reinforcements to address her non-compliance. And then we also want to encourage independence. However, her previous assistant did all of Janie's written work. So we might approach this goal in smaller steps to reduce frustration. And I think what Michelle suggested was that co-writer would be a really good step to getting to our written goals. And then we also want to use preferential seating and strategic seating to help with any sort of hearing deficit in addition to the FM. And then we might introduce the use of headphones in the classroom to act as a twofold. They're going to help reduce classroom distractions and then also desensitize Janie for future audiologic testing. We'll consult with a BCBA to implement IVA therapy and provide interventions to address Janie's classroom behaviors overall.
Sarah, how would you present this to the mom, since the mom is the one who came to you?
I'm not sure when. I know that was mentioned previously that she has an IEP, but in our little blurb, we were told that mom is very active with Janie, so I think she would be very receptive, especially with these new recommendations. So just we don't want to overload her because we do have quite a few recommendations for intervention, but just getting her involved and going over each of these steps with the teacher as well, since I think it said that I started 3 months ago as the new teacher assistant.
Terrific segue. We want to go back to Brandon since he's the teacher. Yeah. So we'll open the mic for Brandon.
And so, Brandon, you've hopefully just heard a little bit about what some of the school team is working on. But I know we actually asked you some questions about her food use in school. So you can weigh in on both or either.
All right, Brandon, you're unmuted now.
Is it possible you can go back to this? I don't have my slide up right now on my computer.
Oh, that's okay. We can go back. I'm aware that we actually asked you about, like I said, some of her dietary needs, so you can start there.
Brandon, first give us your own professional background and then go into your role.
Perfect. I'm a school psychologist, currently doing my PhD in counseling psychology, and that's where my background comes in. I was asked to be a teacher for this role. So as a teacher, I would connect with the dietitian and the parapro and sit down to develop a eating schedule for Janie to adhere to while she's at school, and ask the dietitian to provide creative snacks that are tasty, that don't include dairy and are not sugary. Since she struggles with spelling at the beginning of the school day, she should be able to start the day in another activity for a short period of time to get her comfortable in the environment. And then the parapro can go over a modified version of spelling and writing with her before she rejoins the classroom activities. Or spelling and writing can be moved to a different part of the day to see how she responds to that. It would also be beneficial to ask Janie's parents what she's interested in besides food, like what type of reinforcers that work for her, that are good reward choices for her, so it doesn't have to be edibles. Yeah, so like, stickers or playing a short game with their aid. Just other things to reduce the amount of food we're giving her so she could better adhere to the schedule set forth by the dietitian. Also, since the school has, ASD room, working with the dentist, the ASD consultant, the teacher could discuss ways to promote oral hygiene while in school and figure out different activities that would allow her to become comfortable with the dentist environment so that when she goes to the dentist, those types of sensitivities could be worked out.
Awesome. Thank you, Brandon. Yeah, and
we're assuming everyone from Team C has arrived.
So I'm going to start skipping forward. And actually, Brandon, that was perfect timing because the last team that's presenting is her dentist. So we can hear how things are going over there.
So Kayla, are you there?
No, she's not on yet.
Okay, so we'll start with Brittany and then come back to Kayla.
Yep, and I'm sorry, be patient while I skip forward.
Go back one.
Oh, thank you.
There you go.
So yep, this is Janie is actually overdue for her dental exam. So let's hear from
the family member
about how that's going or what the plan is.
So we go to Brittany before we go to Philip.
Hi, can everybody hear me okay?
Yep. Great.
Awesome. So I'm Brittany Damrow. I'm a registered dietitian and I work at Michigan School for the Deaf actually. But for now, I am a family member for Janie. And Janie actually hates things in her mouth, and especially with the recent speech and OT therapies that she just encountered, it made it worse for Janie. So as a parent, I am feeling very anxious, and I feel like I need to try to really distract my child as much as possible. She loves cartoons on her iPad, so just to make sure to bring the iPad during the visit, so if she does need a break, she can take the time to watch cartoons, settle down, and if possible, just try to encourage gentle rubbing if she lets us at home before the appointment, gentle rubbing of the gums and that type of thing. I'm feeling very frustrated, just guilty and kind of helpless due to Janie's lack of cooperation with the dental visits as well, which might be why we're overdue for a dental exam. So.
All right. Philip, are you ready?
Yes. Can everyone hear me all right?
Very well.
Perfect. So one of the suggestions I have, so I actually consulted Brandon.
Okay, just give us your background.
Oh yes, my name is Philip Young. I'm a third-year dental student, and my role for this activity is as a psychologist. So for this role, I actually did consult Brandon, who is a psychologist. So thank you, Brandon, for helping me out here.
Good collaboration there.
One of the things that I'm going to recommend is to provide the ABA therapy. I know that was mentioned in the previous groups as well, for Janie to help improve her social behaviors and improve her behavior, especially in a dental setting. Now, one of the things that Kayla will mention when she talks about dentistry is focusing on desensitizing, and actually Brittany also mentioned this with their oral aversions, because Janie herself hates having things put into her mouth and just won't open up at the dental office. One of the things we want to work on is desensitizing her, not only to any oral aversions that Janie might have from either tooth decay or just the fact that she doesn't like having things in her mouth, but also the environmental stimuli. That's a big thing. So some of that would include, the drilling sound, the bright lights, or just, the dentist wearing the white coat. So by enforcing some sort of desensitization protocol for Janie, I think would be very helpful in opening her up to the dental setting. Another side note, just because it was noted in the overall case that Janie does have a lot of communications or problems with communicating, to refer to a speech language pathologist to help catch her up to speed on that as well. So,
in terms of your background in psychology, the role that you are playing,
yes.
Did you consult or talk to the family member? I know you said you talked to Brandon.
So I guess in the role play, yes, I would be speaking with the family to see what habits that Janie displays at home, to see if they're, if it's translated to the dental setting, or if it's strictly in the dental setting in which Janie is being more difficult per se. So I would definitely speak with the parents and to kind of get the full picture as to what we're looking at in terms of Janie's perceived dental care and dental needs.
Thank you.
Awesome. And I think it's true that our dentist is actually not here to report quite yet, but she's going to chime in. It's like a tag.
I'll let you know what she gets.
Yeah, it's like a cliffhanger. But we do have another dentist who happens to be on Janie's team. So Katie, I gave you a heads up that I was going to ping you later. You've mostly been collaborating with her teacher about some of the sugary snacks and the dietitian, but hearing the psychologist's recommendations about desensitization. Katie, is there anything that you can see from your school collaborations that might help Jane out here?
Yeah, so from my real background, occupational therapy, I think kind of combining the dentistry and the school, a possible exposure to a picture schedule may help. Kind of either the dental hygiene process of brushing teeth or going to the dentist or whatever she may need, showing that in a picture schedule or laying out cards about how exactly the process goes to show her exactly what's going to happen, because I feel like if she's informed that desensitization, that's going to better help her.
Thank you. That's great.
Go back to Kayla.
Yeah, so Kayla, we know you just joined, and I'm going to give you the 2-second hot seat review of Jane's team meeting. But what we've seen is that you just heard from her other dentist who's been working with school, and we've just heard from Janie's mother and then the psychologist who's helping you in the dental office. So we're wondering how you are working with Jane's oral aversions in her dental appointment.
Well, I thought about, can you hear me?
Yep. Yeah. And Kayla, can you tell us your real background too before you tell us who you are as a dentist?
Yep, I'm in speech language pathology. So actually when trying to think from the dentist perspective after kind of looking into the scope of practice, I couldn't help but tap into my speech language pathology side of things. So I thought about a lot of like visual supports, sensory supports, just to make it easier on her for the overall process. Doing more of like we called it the tell, show, do method. So showing her the tools, letting her feel the tools, play with the tools, maybe trying some techniques on mom or having mom go through the entire process of the exam just to make it more comfortable for her. Because if she doesn't know what's happening, that makes it all the more scarier and anxiety inducing.
Kayla, would you also recommend maybe a sibling just to show how to get in and out of the chair or something like that?
Oh yeah, absolutely. The more modeling, or maybe even like a social story or video modeling to show what she would need to do or be doing.
Thank you. You were all asked to look at a scope of practice in terms of your own background versus the background that you were playing. Anybody who'd like to make a comment at this time before we go to the next slide?
Jenny's letting you break character for a moment.
For a moment before we go. Anyone who wants to just unmute yourself and
I thought it was just interesting hearing the perspective of the other disciplines from other teams, because we weren't given every single bit of information about Janie. So that's kind of important in the real world when we're working to understand that maybe we don't have all the information from other areas of Janie's life, because they might not pertain to us, or the parents might think that it doesn't pertain to us, but in actuality, working multidisciplinary, knowing those things can help our practice.
Thank you, Katie.
That's actually a perfect segue. You guys are really good at that. So what we're gonna do is switch gears or zoom out, I'm gonna say. I want you all still to be working in your assigned roles. And we are gonna be, I'm sorry, I'm having trouble advancing the slide. Thanks. We're going to be working as a whole team together, and I'm going to open this up for discussion a little bit. So I'm hoping Mike can help us too with some of the hand raising, and so that we don't talk over each other, help us with some of the unmuting.
Before you go there, there was someone had talked about the circle of care. So feel free to chime in that comment that you were making while someone was speaking at this time.
And as always, if you have a comment or question, just click on the raise hand button and we'll get to you.
So sorry, before we do that, I have just a couple of ground rules. One is you'll see the life slide is up, and that's because we want you to be thinking about these core pieces, right? Leadership, interdisciplinary, family-centered care, and equity in terms of coming up with your whole team plan. And I'm going to does anybody want to volunteer to be speaking and summarizing the whole team plan? Any hands raised over there, Mike? Yep.
Are you talking about each team individually?
Anybody.
Nope. So what I'm hoping for is one person who's going to be kind of taking in the discussion and then going to give feedback to our family members who are here about what the final plan is going to be. And I'm asking you guys to, based on everything you've heard, and I'm going to give a couple summary sentences, prioritize. Let's come up with 3 steps that we can do for Janie today, or that we can recommend today, because I think somebody already mentioned this is a lot of information for a family to take in. So do I have a volunteer? Typically in this role, many of you know that our physician colleagues are the ones who tend to lead the team meetings and tend to be the speaker of the team. So I'm going to volunteer Emily as our physician tonight to be the speaker. We've heard that Janie has a lot of difficulty with compliance with her diet. We've heard that she has a lot of behaviors and behavioral presentations that are disruptive. That happens overnight. At school, it happens in the morning. It happens a lot around spelling and reading. Her neurodevelopmental treatment team has concerns about expressive language, knows that that's a frustration for her, and that might be a trigger. Also sounds like she has some mouth pain, and she has a really strong oral aversion. I'm sure I'm not capturing every recommendation, but this is a lot of information that we condense.
So I guess my first question to the family members would be, what else do you guys want to see, or what would mean most to you? If we only had to implement 3 things, what would you care about?
Can you repeat the question? I'm sorry.
No, it's okay. So as a family member, this is a lot of information and a lot of suggestions that we threw out at you. And I just kind of wanted to know if you had to pick your top 3 things of areas you wanted to focus on, she's eating crayons or something like that. What would those be?
I guess I would want to make sure that Janie is in the best possible health that she is. So for me, that she's eating okay and that she is able to eat. She doesn't have any GI issues or anything along those lines. She's being educated, so she is having the support at school she needs regarding education and her what she wants with her IEPs, with her language, with et cetera, et cetera. And also that she is just being taken care of. She's comfortable, she's happy. So I guess those are the couple of main things that I would want to focus on as a family member with professionals, is her health and happiness.
Jay, do you have anything else you want to supplement with what was just said?
Yeah, I was just going to add that, the educational part just might not be the top priority of Janie personally. As a family member, it's important for us to put Janie's education on top of the list, but she herself might not be so interested in learning per se at this stage of her life. She might just want to eat whatever she wants and have fun in life and have friends. And so in that perspective, supporting her desires, I as a family member, I would just want to make sure that we come up with at-home care plan, including a more favorable diet plan for her, so that we're not constantly worrying about her running into the pantry and grabbing whatever she wants that could potentially hurt her down the road, even every morning if she's getting stomach aches. So things like that, the daily things that we can do to make sure that she's healthy.
I want to go to Christine on this one. In your regular role as a medical student, what would you recommend to Jamie's mom regarding the aches?
What was the last word you said regarding the what?
Aches, her stomach aches.
Oh, okay. Well, first of all, I would probably want to double check to make sure that the diet she was on is working for her, because there's no need for her to be on this diet that's hard for her to follow if it's not showing any results. So I would want to check with that first, and then make sure that, like, try to find out why the food she's eating is making her stomach hurt, like if she has celiac or anything like that. But I think the most important thing would be to get on board with everyone that works with her and tell them what she can or can't eat, because my information that I got as the occupational therapist didn't really tell me like what she was allowed to eat or not. So if I was rewarding her with food like they are at school, that could be hindering her health. So I think it's important that to tell the mom to make sure that everyone's on board with what she's allowed to eat and what she's not, so that all of the work being put in at home isn't being canceled out at her therapy sessions.
And I think our dietitian actually has some really important information about what she found in terms of what makes Janie's stomach upset. I'm sorry, I'm looking to see who it is.
That was Madison.
Yeah, I can kind of chime in for that. So we were just given saying that I'm suspecting that she might have difficulty digesting dairy, and that her parents have reported some stomach complaints following more dairy-heavy meals. So maybe things like mac and cheese. So really, as far as that goes, I would want to possibly look into getting some testing to see. I don't know how you go about that, because I would want to turn maybe more so to Brittany.
Yeah. Okay, Brittany.
But
let's have Brittany comment back on that.
Yeah, so I guess if you wanted to get a dairy test, you could always do an elimination diet, see if, and this is very, could be done at home. You don't need to go to a doctor's or anything. You could do an elimination diet. So eliminate all dairy, all milk products, and see if that helps her tummy. If it doesn't, then gradually you can add it back in if you want, but just to eliminate what is suspected to be causing problems is a possibility. Also, allergy tests you can do with a doctor.
Thank you.
Sandy, you have your hand up. Go ahead.
I did. I apologize. We got off to kind of a quick start. I am Sandy LaPrette. I'm on the LEND program as a family member. Work as a nurse with Children's Special Health Care at the local health department. I have 2 special kids of my own. My role was the physician, and we did not have a lot of information about the whole bigger picture we were looking at, but some of the things that I had come up with was looking for the cause of her stomach aches. Is it her diet? Is she on a ketogenic diet or some special diet? And is that the family's idea, or was it the physician's idea? And it should be followed by a dietitian. The other thing was to keep a full log of the things she was eating and the reactions she was having. If she's better controlled on the weekends, obviously there must be tighter control on the parents' side of it. So, yeah, getting the school involved. And as far as stomach aches, having the parents keep some kind of a log as to what her schools have been doing. Is she having any problem with that? And as a physician, I guess I would look and see, has she tried any other seizure medicines? Or is this one in particular that's caused all these problems? Is there an option to try a different medication?
Thank you, Sandy. Would any of the those that are dentists in our program here would like to make any additional comments. The real dentist.
Hello, can you hear me?
Yes.
Yes. So one thing that crossed my mind is if Janie is sneaking into the pantry at night and eating all bunches of food, and she's having stomach pain, maybe she has some sort of GERD, like acid reflux, which could also adversely affect her oral health, which could possibly explain why she has some sort of oral aversion. So I don't know, those are just kind of some thoughts that are going through my head as I'm hearing this case unfold a little bit. The patient's diet is affiliated with her stomach pain and then her dental health as well. So that's kind of what I'm seeing go on. I don't know if Jay has anything to add there.
I'll just add that with her ASD, she might not be expressing any sort of discomfort in the mouth well enough. So she might have some dental or intraoral issues that might be causing her to not chew as well. And so the lack of mastication might be contributing to her lack of digestion, which would lead to potential stomach issues. So that could be another issue that dentists could look into and make sure that they're problem-free down the road.
Thank you. From the audiology standpoint, is anybody wanting to jump in from your role as a regular audiologist, not the role you're assuming?
Yeah, so it sounded like from the audiology perspective that they hadn't really obtained a lot of information in the past, either because it was just difficult to do the testing or a lack of cooperation, which does happen. But there are other means that we could assess hearing. So typically in children or individuals that are difficult to test, we can do different, just like you guys learned about the ABR, and other measures like in conjunction with other procedures. So if they are going to be sedated potentially for dental cleaning or something else, we can do that in conjunction to get a better idea of what she's actually able to hear, because that could be a huge impact on the speech and language development and the future plans for that and recommendations.
Well, I just want to make sure before we move to our next slide that we actually come up with recommendations. Emily, I think I'm hearing from the team a lot of commitment to working up her stomach issues a little bit further and trying to get a better handle on what those are. And I think some of your colleagues have made a really astute comment that might also involve a more comprehensive dental exam and more comprehensive dental workup to rule out any oral motor issues. What would be the third piece that you'd want to start with right away that you're hearing from the team?
I think I just heard it from two people, but I think ABA therapy would be the next step or the third suggestion. It is covered by insurance in Michigan, and I think that with her ASD and her behavioral issues right now that she's displaying, I think that could help.
You're getting thumbs up from your team. Does anybody else want to comment on that? Or do folks feel like that's a good third step for this patient?
Maybe Brandon can chime in here.
Sorry, ask the question one more time.
So Emily's proposing as the physician that we really push for a period of ABA therapy to start with for Janie as another thing to move on right away. You're in the role of her teacher, I think, right? How do you feel about that recommendation?
I think that'd be a great idea, and that's actually good, especially with her diagnosis of autism. And we can get a schedule pinpointed down that she could stick to throughout the day and transfer it at home. I think it'd be good. I think, especially at a time we're implementing a lot of different changes in Janie's life, start the foundation with this would be excellent for her.
Awesome. So who on the team is going to be our ABA lead probably? I'm wondering if Ishmael wants to comment on that as our...
You can hear me now.
Yes. Yeah. So if we're trying to get her hooked up to speech or to ABA therapy, you're a speech pathologist.
So what are the things that you're trying to do though? Is it that you're trying to work on the aversions, or you're trying to work on the behaviors, or you're trying to work on the food? If you're trying to work on the aversions, then I would start by going with the smaller bite size, like even just having her touch her lip to the actual food that she has an aversion to. And then if she's agreeable to do that, then we can move to like rice size, and then slowly to 1P, and then the 2P, and we.
Oh, wait, you froze on us, but I really liked where you were headed with that.
Yeah, me too.
And I think establishing those clear goals and then having incremental steps that we're focused on building towards.
Kate
Ask Kate to pick up. Kate, did you hear that? Jenny's hoping you can fill in.
Kate, can you fill up? All the way down.
Fill in on the
On what Brandon was just speaking, we lost his control.
I liked where he was going as well. I thought it's a really good idea to set clear goals so that you're not. I know there's a lot of different things that we want to address with Janie, and so if you start with really clear goals and work through them, then you can actually see some real progress. So I think it's a great start.
I think Kayla had her hand up, so maybe we should go back to Kayla.
I was just going to comment a little bit on what Ismail was saying before he froze. Even with doing like a feeding hierarchy like that, you could start so much smaller than just actually touching the food to the lips or the tongue. I actually have a client right now that has autism and food aversion, and the feeding hierarchy that we start out with is actually just smelling the food, not even touching it to any part of their body, but just smelling the food, and then working towards manipulating it with their hands, not even touching it to their mouth, and then moving up to touching it to their lips, and then to their teeth, and then to their tongue before actually even putting it in their mouth. So you can break it down into even smaller steps to really make them more confident in the steps that they have achieved. So if they're really comfortable smelling the food, then just going to touching it rather than skipping straight to the lips. And then implementing visuals. So my client has huge poster board or full page size steps of the feeding hierarchy with pictures as reminders and supports in going through those steps.
Thank you. Very good points.
You guys have done an excellent job. I think we have pretty clear first steps, at least. Certainly there's a lot more care that Jane's going to need. I want to give her family the floor one more time and just make sure her mom and her brother don't have any additional questions for the team.
So let's go to the brother first.
I think it was Jay, right?
Jay. Jay, you were playing the role of brother?
Yeah, I am. Could you repeat the question, please?
As we're wrapping up as a team, do you have any lingering concerns or lingering questions? Sounds like your team wants to work up her GI concerns more, do a full dental workup, and then get her enrolled in ABA therapy as soon as possible.
Yeah, from what I understand, sometimes ABA therapists are, I don't want to say against, but not always in agreement with sensory treatment plans. And I think her oral aversion has a lot to do with sensory issues. And I think in addition to the ABA treatment planning, I think occupational therapy involvement will be really helpful too. Because I think that one of their heavy focus is also on sensory integration. I think that'll in turn be really helpful for dental care as well down the line. Besides that, I think all the other points that I can think of have been covered.
Thank you, Jay.
Awesome.
Okay. In the interest of time, we're going to move to get some feedback from you on anybody can chime in or put your hand up and Mike will open it to you. We have 2 questions. I'll start with the first question, give a few of you time to respond to that, and then we go to the second question. The first question was, how did your understanding of the different healthcare professionals' role change when you were discussing in your individual teams?
And just to be clear, we're all speaking from our own perspectives now. You guys did an awesome job with the role play, and this is just our chance to reflect a little bit.
Yeah. Anyone can chime in for your own role as your regular role, and how did you feel playing a different? So Emily, you can start since you have your hand up.
For me, it was extremely difficult because I didn't know anything about primary care. Well, I know like what doctors do. Like I know what doctors do. I don't know a lot about the medical field. So it was interesting to me to have to learn everything and try to implement a plan. So that was different. And then I think Katie mentioned this before, but that the fact that we didn't get all the information. Like, I think our team talked for like 20 minutes about if the child had an IEP plan or not, because we didn't know. That wasn't in our info. So that was kind of difficult too, to maneuver, but yeah.
But that's exactly what we wanted to show you, that you might get clients that come to me with no information sharing, that are not ready to trust in you and give you bits and pieces of information. So I'm glad you got to hear the rest of the teams and give you a better idea there. I thought I saw somebody else's hand up, Mike. No? Yeah. Anybody else? Yeah, there we go. Go ahead. Ishmael, you can speak.
Can you guys hear me?
Yeah, we can hear you.
I think it was important to look at the other disciplines, because that's really what they kind of all intersect and they drive each other. So as a sports psychologist, you want to, if you're focusing on food, you want to kind of know from a family perspective what they eat at home. So having them eat things in a clinical situation that they're not eating at the home and stuff doesn't have much practical use. So you want to try to get that understanding. And you need understanding from the doctor as far as their growth trajectory, as far as the calorie intake that they're getting, in terms of if there's any type of blood imbalance, or if there are certain vitamins or things like that they're not getting. So you can focus on this. So if there's a particular deficit or deficiency, then you can work on those things, particularly in the therapy. So you kind of need everyone to kind of work together in order for you to do your job efficiently.
Okay, thank you. Anyone else? I'll take one more on this question before we go to the next. All right. Okay, I'm going to go to the next question then. What were your attitudes and feelings about working with an interprofessional team that you didn't have before your discussion? So you all did the ripples before we started this whole program. So what did you get from this now?
Jenny, can you just explain the ripples or just say what it is? It's just like one second.
It's a readiness for interprofessional learning. So it's a set of questions that we had them answer before this module. Actually, I think before
they started anything with us. And tomorrow they will get to do the post.
Got it.
Okay. So anybody wants to talk about your attitudes and feelings now about an interprofessional team? We don't want to call on anybody, so
Go ahead, John.
Come on, John. John's back. Good job. John, you're back, and then we go to Sandy.
Hi, guys. Honestly, I'm not sure you'll all like this response. But before we kind of started this whole interdisciplinary training, I honestly felt like a lot of roles held more weight in terms of importance for the child and the family. For instance, I kind of held in high regard physicians and psychologists, and did not think that, dietitians and audiologists had as important of a role in treatment and development. And I was sorely mistaken. And obviously it changes from, individual case to individual case, but after spending a few days at the audiology clinic and, talking to the people in the dietitian, the SLP program, it's like none of this can really have a great effect on, children and families if it's not all done together. So
thank you, John. And let's go to Sandy.
Well, I have to agree with John. I think, depending on the child and what their needs are, sometimes the medical aspect of it does take kind of the backseat, whereas you've got the school that comes in and, the socialization and the just being successful in society. Sometimes that physician's role does take a backseat. So I always like working with teams because I like to get the different perspectives and have people reviewing the care for that particular child and family.
Thank you, Sandy. And we go to Katie.
Yeah, so in my PEDS class right now, actually, a few weeks ago, we were talking about multidisciplinary versus inter versus transdisciplinary. And I think the movement towards transdisciplinary is actually like the most beneficial, obviously, but there are logistical concerns that keep a lot of people from doing that. Instead of just having this coming together, sharing the information, even like it's even hard enough to get that from each perspective, but then to understand the information from another discipline and then put it forth into your own work for your discipline to better that child's outcomes. Transdisciplinary, if you will, is just the best approach.
Thank you. Philip?
Yeah, I feel like this exercise was in particular very useful because, day in, day out, I'm engrossed in the dental world. And by forcing me to evaluate a case study such as this from a different perspective really opened up to what John was saying, the importance of all the other healthcare providers and everyone who's associated in the care that we're trying to, the whole family-centered care that we're trying to push forward with the life. So I really appreciated this assignment, and it really made me think and value the other professions very much so. So thank you.
Did
That's
you?
always nice to hear.
Yeah, that's nice to hear. Did any of you hear any jargon when your teams were meeting? And did that cause any problems?
Did you say jargon?
Jargon. Yeah.
Okay. Not really.
Had any jargon? No? Okay.
Was it frustrating to have to work in somebody else's perspective? You can just raise your hand if you say yes. You don't necessarily have to comment. A couple hands, I think
that's good. That's good.
I think that's a really normal reaction, and I think, I'm sorry, I already forgot who said it, but it's a really good point that transdisciplinary work is hard, and sharing communications across team members isn't easy. So was that frustrating for everybody? Show of hands. For some.
Did being receptive to others' point of view here cause frustration at all? I don't think.
Jenny, are you trying to ask if anybody said something that made you mad?
Yes, exactly. Did anybody feel that, Kayla? Yes, okay. You want to expand on that, Kayla?
Yeah, I mean, not mad, and I know I missed a little bit of the beginning, but when we were talking so much about like the stomach issues and like how big of a deal that is, I was kind of going through and reading some of the other teams' information to get a little bit better of a background since I missed the beginning. But I was just thinking about like the expressive language and the receptive language being so low, and I just wanted to scream, we need to get this child to communicate. So for me, it was hard to sit back and, I chimed in with the food aversion, but to talk so much about like the dairy issues and the diet, and I just want to like get that child some form of communication ASAP. So for me, it was hard to like chill out and take a back seat a little bit on that, because that's my entire profession is communication, and knowing that child is delayed there, that's all I wanted my focus to be.
Thank you. And how about Brittany?
I think that raises a good point, because a lot of times we do think our profession or what we want to do with the child is the most important. And
the parent or the child comes back to the next appointment with no success or no progress, and we're wondering, well, what did you do? What did you not do? And it's like, why didn't you do it? But there's so much information that they're loaded with and that that they need to do. So we have to kind of respect that. We have to respect the other professions and really realize that they are going through a lot right now, and all we can do is support them.
Thank you. I know we got a few minutes left. Emily, did you have anything else, or did your hand not get lowered at all?
Great job, team.
Okay, thank you. All right.
I mean, we can echo that. I think you guys did a really successful job. And the last piece I want to say about it is it's even harder over a webinar when you can't look at each other and you can't communicate. And even though it's a challenge, Jenny and I did this on purpose because this also represents what our real lives look like.
And both of us are in 2 different cities here, and we did this online too, so you can see the frustration on our end too. So it wasn't easy trying to teach this online as well.
But I think teaching this is the kind of thing that that we have to practice, right? This is the kind of venue we have to practice working in if we want to create that transdisciplinary model.
Yeah. So
I think this is the one you want to do.
Yeah. So just to end, we wanted to make sure that we conveyed to you that by being in a team, you are increasing the quality of care, you're increasing safety of care, and you're also decreasing redundancy and cost of care because it's part of your life model, and we wanted to bring it right back to you so you get the last points there. Is there anything from any mentor who is online who might want to say anything else? You can put their comments up. It's okay.
Oh, no, there you go.
Any of the mentors want to say anything? Hardeep, are you still there? Hardeep is gone. Okay.
Yeah, I'm curious from Lisa too.
Lisa, are you there? Lisa, your mic is unmuted. Go ahead.
Hello, can you hear me?
Yeah.
Oh, yes, I'm still here. I was trying to get to, thank you for unmuting me. Yeah, I think this is a great activity. Everyone did really well. Really interesting to hear, the points of view after the fact, but all of you did a great job.
Anne, do you want to say anything?
Hi, can you hear me now?
Yes.
Yeah, we got you.
Sorry, I couldn't find it. I don't have anything to add. I just really always really love this session. Thought it was great.
Want to give last 2 minutes to our guest out here. Whoever wants to take the mic, and both of you can, but let's take one at a time.
I've just really enjoyed hearing your perspectives, especially from the start of this process to the finish. And I liked, I think it was John's point about coming into this with some preconceived notions about, certain disciplines, perhaps, they're carrying more weight in a treatment team setting and finding that perhaps that's not really the case.
Thank you.
And this is Ben. I didn't give my full introduction, as I actually have 2 roles, 2 interdisciplinary roles. I'm a family member and a social worker, and I think what struck me from all of your comments is the fact that so many of you felt like you needed to collaborate. You needed to collaborate. You needed to ask questions of each other in order to get the full picture. And you all did. A lot of you, especially, did a really nice job of weaving in multiple perspectives into the recommendations that you were making. And I think thinking outside of your discipline also is thinking about how you interact with other disciplines and how other disciplines need to interact with you. And I thought that you guys did a great job of thinking along those lines.
Thank you.
I just wanted to add one thing. This is Sharon. I don't think you can see me. But what I really liked at the end when you were doing your synopsis, Emily, you went to the families and asked them, you gave them the top role of
That was awesome.
What was most important to the family. I thought that was a really, really strong move there.
Also, the psychologist in me is always cheering when a physician says ABA therapy. So that was also fun to hear. Everybody did a really nice job.
And the interprofessionalist in me just couldn't be happier with the whole session. So thank you all and good night.
Good night, you guys.
Bye-bye.
Module 11 is open to you all now, and you will have an evaluation for this session in your inbox in about 30 seconds.
And your Ripples post survey, please complete that. It's online.
We'll be sending that out tomorrow.
You get the link tomorrow morning. And perfect timing. Good night.
Good night.
Nice evening.
Good night. Thanks, everybody.